Circumstances such as taking an academic assessment, participating in a job interview, speaking in front of an audience, or even experiencing a first date with that special someone have the potential to trigger anxiety. This biological phenomenon is activated as a mechanism that puts us in a state of alert, ready to deal with challenges. My name is Lucas, and my goal is to share my studies on mental health and personal development with you. This is our channel. In today's video, I will share with you the effects that anxiety has on your body, how it reacts to this disorder that affects millions of people. Given that it is a common response to stress, the expectation is that this emotion will disappear once the stress is overcome. However, for many individuals, anxiety persists chronically, interfering with daily routines. In these scenarios, even though aware that the fear and worry exceed the relevance of the initial stimulus, these individuals exhibit cognitive, physiological, behavioral, and affective manifestations. When pressure increases, all these aspects worsen, resulting in crises. Anxiety-related disorders represent the most common psychiatric conditions worldwide. Currently, 40 million adults suffer from high levels of anxiety, with worry and excessive fear being common symptoms. Women, when compared to men, show a greater vulnerability to these disorders. In the United States, it is estimated that around 6.2% of the population suffers from an anxiety disorder. In the workplace, 37% of people face extreme stress levels, with anxiety impacting 63% of this group. Distinction between symptom and disorder. The term anxiety describes an emotional state characterized by feelings of fear, panic, or restlessness. Moreover, this same expression is used to encompass various categories of anxiety-related disorders. Check out some examples. Generalized anxiety disorder, constant worry and tension lasting more than 6 months, approximately related to situations such as health, money, employment, and family. Panic disorder presents sudden and intense panic attacks without a trigger, lasting a short time, followed by the fear of having another crisis. Phobias characterized by fear or dread of situations or objects that, for most people, pose little or no real danger. Flying, spiders, crowded places, social situations. If you enjoy a good read and want to discover proven strategies for overcoming anxiety, I'll leave the link to my ebook here in the video description. Get it now. Let's go with the video. Understanding the mechanisms behind a crisis. According to the consulted experts, it is emphasized that not all individuals with anxiety disorders experience acute crises suddenly. This type of occurrence is more common in cases of panic disorder. Nevertheless, crises can also occur in the context of generalized anxiety and other psychiatric disorders such as depression, bipolar disorder, or social anxiety. Additionally, even among individuals without a formal anxiety diagnosis, these crises can manifest in situations involving intense fear. At this moment, the body responds as follows. Activation of the CNS central nervous system, interplay of neurotransmitters. Your brain triggers the mechanism. To initiate the response to stressful situations, the central nervous system, composed of the brain and spinal cord, comes into play. Functioning as a communication system, it mobilizes neurons and their chemical messengers, known as neurotransmitters. The neurotransmitters called into action include norepinephrine, responsible for maintaining alertness, serotonin to regulate heart rate, mood, etc., dopamine to increase motivation, and GABA-gamma-aminobutyric acid, which controls excited reactions. The sympathetic autonomic nervous system SANS, responsible for regulating the body to face danger, intense effort, physical and psychological stress, is the one that commands most of the reactions that will soon manifest. Research indicates that the amygdalas, a set of neurons located in the deep region of the temporal lobe responsible for processing hearing, language, and memory, play a significant role in these transformations, acting to alert the body to possible threats, leading to feelings of fear and anxiety. The amygdalas become more active in the face of stressful situations. A group of elements comes into play. In both moderate anxiety situations and during crises, the hypothalamus, pituitary gland, and adrenal or suprarenal gland, which make up the HHA circuit, play the crucial role of releasing adrenaline. This process results in a true organic flood. In response to this stimulus, the sympathetic autonomic nervous system initiates a sequence of processes that manifest through various symptoms. Cognitive, fear of losing control, fear of injury or death, fear of going insane, concern about others' judgments, terrifying thoughts, mental visualizations or memories, difficulty concentrating and focusing, mental confusion and hypervigilance to threats. Physiological manifestations, increased heart rate, palpitations, difficulty breathing, chest pain or pressure, feeling of suffocation, sweating, episodes of heat or cold, tremors, nausea, stomach discomfort, diarrhea, weakness, muscle tension, stiffness, and dry mouth. Behavioral, tendency to avoid situations, seeking escapism, looking for safety and tranquility, restlessness, a sense of paralysis, and difficulty expressing oneself verbally. Affective aspects, feelings of nervousness, tension, fear, terror, irritation, impatience, and frustration. Why do I have anxiety? The origins of this disorder have not been fully elucidated. At present, we understand that it results from the interaction of various elements. Genetic factors, individuals facing anxiety often have family members affected by the disorder. Traumatic experiences, childhood traumas, such as abuse or neglect, as well as events like relationship breakups, are associated with the development of anxiety. Consumption of central nervous system stimulant substances, the use of substances that stimulate the central nervous system, such as ephedrine, theophylline, Ritalin, caffeine, cocaine, among others, can contribute to anxiety. Withdrawal from central nervous system depressant substances. The withdrawal of depressant substances from the central nervous system, such as benzodiazepines and alcohol, can also be a triggering factor for anxiety. Is it just a crisis, or am I facing panic? Although the symptoms of an anxiety crisis and panic share similarities, the distinction between them lies in the fact that the anxiety crisis usually develops from a known triggering factor, such as economic, family, or health issues, and progresses gradually. On the other hand, panic is an intense form of anxiety crisis that can occur without an apparent cause, manifesting as part of the disorder itself. Moreover, it can arise in response to other psychiatric conditions such as phobias. Panic attacks can happen unexpectedly, reaching their peak within a period of 10 to 30 minutes, although some symptoms may persist for a few hours. To identify it, at least 4 of the described reactions must be present. The acceleration of the heart rate and the feeling of distress are so intense that they can be mistakenly associated with a heart attack. However, these manifestations usually diminish rapidly. In contrast, during an anxiety crisis, the symptoms are often less intense but persist for a longer period. Tips for dealing with pressure. In addition to incorporating healthy habits such as prioritizing natural foods, staying active, ensuring good sleep quality, and setting aside time for leisure, experts recommend adopting the following measures. Educate yourself about anxiety. Gain knowledge about anxiety to be able to identify symptoms in yourself. Seek specialized help. If symptoms and crises occur frequently, it is advisable to seek professional assistance. Anxiety treatment is effective, providing relief from symptoms and improving the quality of life. Do not ignore symptoms. Ignoring signs can worsen the condition and, when untreated, increase the risk of developing other conditions such as heart disease, diabetes, substance abuse, and depression. Consider psychotherapy. Psychotherapy is one of the effective strategies in treating anxiety. Explore relaxation or meditation techniques. Try different approaches until you find the one that suits you best, seeking relaxation or meditation techniques to help control anxiety. Collecting the information for our video, I can affirm to you how terrifying a panic attack is and how much this disorder can truly change your life. It was through medical assistance that I managed to get through this phase in my life. If you enjoyed the content and are interested in topics that enrich the mind, aiding in personal development, I invite you to subscribe to this channel. Until the next video,